The topic of recurrent tonsillitis and who should get their tonsils out has really waxed and waned over the generations. If you talk to some of your parents, you might find that when they were younger, they and their siblings all lined up and had their tonsils and adenoids removed on the same day. We've really tailored down who should consider that surgical intervention. Now you'll see two major categories that we discuss with those tissues, either chronic infections or obstructive issues, both of which could lead to surgical intervention. Recurrent tonsillitis is a frequent problem for young children, and ultimately when those infections become more recurrent, we will see them in the ear, nose, and throat office to decide on long-term management strategies. Another reason we will see chronic tonsil patients would be for obstructive breathing patterns. A lot of those young children with their petite throats will have trouble breathing, especially when they fall asleep if the tonsils are so large and inflamed that they take up too much space. Adenotonsillectomy does require patients to go all the way to sleep under general anesthesia with an oral intubation, so a small breathing tube that is placed after they fall asleep and is removed before they really wake up, so they never really have any awareness of that. That 30-minute intervention is then followed by a 2-hour recovery before our patients are discharged home. Recovery from tonsillectomy can be difficult. We know that all patients will struggle with some form of sore throat. Now that sore throat might last anywhere from 5 days all the way up to 2 weeks in some cases. After you've had your adenoids and tonsils removed, we do see a really good outcome in the reduction of infectious risk. About 95% of patients won't ever see strep throat again. Now they can still have viral infections or the rare strep throat infection, but drastically improved from their starting point. Those patients that went to surgery for obstructive reasons will generally see improved breathing and near resolution of snoring immediately after surgery. You or your child might have more questions or just concerns that come up during this healing process. Just know that our office is always available for questions, and we are happy to answer them should they come up. If you or your family members have any other questions on tonsils or adenoids, please call the clinic. We'd be happy to help.